everyone. Today we are going to discuss about the knee joint. Knee joint is one of the largest and the complex joint which is present in our body. Knee joint has a huge function in our body because it is constantly under pressure whenever we are doing any form of activity like from sit to stand, standing, walking, running. Constantly the knee joint would be under the weight bearing position whenever we are doing anything, right? So because of that reason you all must be aware about the degenerative changes in the knee, right? That is being termed as OA, which is commonly seen nowadays. Other than that, you must be aware about, like, in each and every family there would be a one member which would be complaining about the knee pain or my knee is hurting, right? So which is commonly seen. So here today I am going to just describe the basic anatomy of the knee joint. Now the knee joint, it has been formed by the three bones mainly, that are femur, tibia and patella. Femur would be forming the proximal part, tibia would be the distal part, and the patella, it is situated anterior to the femur, right? Now, there is some unique feature in the knee joint, that is, it is accumulation of two joints. Like two joints together form the knee joint. One of them is tibiofemoral joint, other one is the patellofemoral joint, right? So here, just describing about the articulating surface of these two joints. One is the tibiofemoral joint. In that, the proximal articulating surface will be formed by the distal condyles of the femur, and the distal articulating surface of the tibiofemoral joint, it is formed by the proximal condyles of the tibia, right? So this is the one articular surface, proximal, which is in the femur, and this is the distal articular surface. So this two together forms the tibiofemoral joint. It is a condylar or a hinge variety of synovial joint. Now coming towards the next, that is the patellofemoral joint. Patellofemoral joint, it is formed between the femur and the patella, right? So there is a plane surface between it. It is termed as the plane synovial joint. Okay, so these are the two joints which together forms the which joint? Knee joint, right? Okay, fine. So we have already discussed about what bones are included, what are the articulating surfaces. There are two joints which together forms the knee joint. That's clear. Coming towards the support system of the knee joint, right? So what are the support system in any joint? That would be ligaments. Ligaments are going to be the major role for the any joint to provide the stability. As we all know, in the joint, it is a portion of the body where you can move it, right? So there is mobility present over there. Whenever there is mobility, you must be, like we all know, whenever there is a mobile thing, stability is also essential. Same way in our joints. Whenever there is mobility, the stability is also necessary. Here for the, in the joints, we are having ligament as stabilizers. Okay, so discussing about the ligaments in the knee joint itself, we are having 7 ligaments. Total there are 7 ligaments in the knee joint which are working to it. Okay, along with the ligaments, there are certain other structures which are also present in the knee joint which makes it compound. That is termed as the menisci. Okay, menisci, it is just a structure which is present within the joint, right? So, okay, I am just going to say, this is the anterior view of the knee joint. Okay, here comes the middle menisci. This is the lateral menisci. The function of this menisci are to just shock absorber. They work as a shock absorber and they are acting as a lubricant as they are situated between the joints, right? Between the two articular surfaces. So this, if these are the articulating surface, this is the one articular surface, this one the another, right? So if there is someone between, right? So the both will not get rubbed to each other. Okay, if any two surfaces rub to each other, it will lead to friction, which will ultimately lead to damage to the articular surface. So for that reason, we are having menisci. They would be providing as a shock absorber. They would be preventing the joint whenever there is loading, unloading in each and every activity. So they are also playing a major role. We have two medial meniscus and a lateral meniscus. Okay, coming back towards the ligaments. We have already talked that there are total 7 ligaments, right? So let's just start discussing about the ligaments. Okay. Okay. So first of all, I am talking about the collateral ligaments. Collateral means side to side. Okay, so one would be on the medial side, other would be on the lateral side. So similarly, the names of the ligament are same way. Medial collateral ligament and the lateral collateral ligament. Medial collateral ligament. Let me show you. Right, so this is the interior view of the knee joint. Okay, so here this is the medial portion, this is the lateral portion. Okay, this is femur, tibia, fibula. Right, here there is the medial ligament, medial collateral ligaments. There are 2 layers of the medial collateral ligaments. One is the superficial layer, other is the deep layer. So one is the superficial collateral ligament, other is the deep collateral tibial ligament, right? So that is about the medial collateral ligament, or you can term this tibial collateral ligament, because one insertion, like the ligament is starting from the femur and it would be ending towards the tibia, right? So one is the medial, so the name is same way, medial ligament, collateral ligament, or the tibial ligament. Okay. Coming towards the lateral collateral ligament, that has been termed as the fibular collateral ligament. You must be aware, like fibula is not under the knee joint. Yes, you are right. But as the ligament is inserting over the fibula, it has been termed as the fibular collateral ligament, or you can generally speak it as the lateral collateral ligament, right? So the function of this both ligament would be to provide the stability of the knee joint in the in that plane, like for the varus force and the valgus force, in both that forces. So basically it provides the stability in the frontal plane, right? Okay, so this were 2 ligaments, medial collateral ligament and the lateral collateral ligament. Coming towards the next 2, we are having the anterior cruciate ligament and the posterior cruciate ligament. So this is the, as you can see, this is the lateral view of the knee joint. Okay, so in between it we are having the ACL ligament and the PCL ligament. One is termed as the anterior cruciate ligament and the posterior cruciate ligament. The function of this ligaments would be, like majorly, whenever there is the anterior translation of this femur, right? So whenever there is an anterior translation, the anterior collateral ligament would be providing support, and it would be like lifting, it would be prevent further translation of the femur, right? So buckling would be prevented, and same way the posterior collateral ligament would prevent the tibia or the femur, both way it would be working from posterior translations, right? So it would be providing the stability in the sagittal plane, right? So this is all. These are the 4 major ligaments which are there. First one was the medial collateral ligament, it is also termed as the tibial collateral ligament, and the second one is the lateral collateral ligament, that is termed as the fibular collateral ligament. Third one is the anterior cruciate ligament, and fourth one is the what? Posterior cruciate ligament. Okay, now we are going to discuss about the further ligaments.
Start.
So the further 3 ligaments are, one is oblique popliteal ligament, arcuate ligament, and the popliteal ligament. So this were the 7 ligaments of the knee joint. Majorly the roles or the injuries are common in that first 4 which we have discussed it well. So the 7 ligaments provides the stability to the knee joint. Now coming towards the blood supply of the knee joint. So here the blood supply would be from the surrounding vessels only. So whenever we are talking about the blood supply, we are talking first about the arterial supply. So it would be provided by the popliteal artery, femoral artery, anterior tibial artery, posterior tibial artery, right? Popliteal artery, femoral artery, anterior tibial artery, and the posterior tibial artery. So these are the supplies of the knee joint. Coming towards the next thing, that is the nerve supply of the knee joint. So it would be provided by the femoral nerve, which would be coming from the upwards, right? So that's a femoral nerve, peroneal nerve, and the obturator nerve. So these are the nerve supply of the knee joint. Okay, fine. Now we are going to discuss about the movements which are possible over the knee joint. So commonly it's a one plane only, but there are also biomechanical, if we see, there are also other movements which are occurring at the knee joint. One is the flexion and extension, right? So the degree or the range of motion of the flexion would be from 0 degree to 130 degree, and then from 130 degree to the 0 degree would be the extension, right? So that is about the knee flexion and knee extension. Other than that, there is a mechanism which has been termed as the locking and unlocking of the knee joint, right? It is also a very important thing which we'll be discussing in the further videos, right? So the locking, it would be depending upon certain muscles which would be responsible for the locking of the knee and the unlocking of the knee. Okay, other than that, there is a rotations which are also there, medial rotation and the lateral rotation. So this was all about the movements which are taking place over the knee joint. So I hope this video was helpful for you, and let's see further.